Hello everyone, welcome to Numark's second podcast. We will be looking at the future of community pharmacy in a slightly different angle to the last time that we did. Can I welcome Emma Seton, Chief Exec of Buttercups. Also with me today I've got Danielle Hunt, Chief Exec of Pharmacist Support.
Yeah. Hi.
And joining us on the screen we've got Gemma Thomas, who's the Director of Strategy for Buckinghamshire Healthcare NHS Trust. Welcome Gemma.
Thank you.
So as I said, what we'll do today, we'll try and get a conversation going around some articles and things that you have brought up recently, particularly obviously for yourself, Emma, with Buttercups and the training of technicians and how all that is going to fit with the future workforce.
Absolutely.
We then take to the workforce, obviously, Daniela, with how pharmacist support really supports that and resilience and what that means and the type of things we can do for the workforce to keep them engaged. And then, Gemma, we're going to involve you in how you see that workforce then being used to its full advantage and talk us through some of the things you've already got going in Buckinghamshire, from right in Aylesbury on the High Street in one of the pharmacies there. So that'd be great to hear that. So Emma, I'm going to start with you very much in terms of this training and the elements that we've got for principally, let's say, technicians and the support team within a pharmacy. And I know Numark has teamed up recently to look at apprenticeship levy gifting and how we improve the numbers of technicians.
Absolutely.
So talk us through what you think is really important in that and some of the things that Buttercup sees developing with the workforce in the community pharmacy setting.
So obviously community pharmacy is under huge pressures at the moment, and we're all aware of what's going on in there, the uncertainty, the lack of funding, and actually quite a rapidly changing landscape as well. So from a technician point of view, there's obviously a lot going on with, even if we go back to, 14 years ago when technician registration came in, we've seen a quite significant change, probably only in the last few years with that technician role. I think when it first came in, it was very much business as usual as how technicians had been perceived. But I think with the change of the education standards back in 2017, we've got a much more step change approach to that then. And I think we're starting to see the fruits of that now starting to come through. So I think there is quite a lot of things in there that are happening. But I suppose one of the stats that really concerns me at the moment is the fact that actually for technicians in community pharmacy, actually in England, there's only about 50% of pharmacies have a technician if you look at the latest workforce stats that came out. So what are we going to do to really support that role, and where is that role going? So one of the things I think has traditionally been a barrier, well, I say traditionally, but probably only since COVID really, has been the willingness to train technicians in community pharmacy. And I think there's been a perception whereby they're training a lot of technicians and then they're leaving. And I think that's been a concern over the last few years. So one of the things I think we need to do is change the narrative around that. And I think we need to be starting to think about, A, slightly more joined up workforce, and B, the fact that actually having roles now for technicians is going to help that retention piece. So there is a lot of stuff coming down the line. We've had changes already to the VAT rules, allowing technicians to do PGDs. We've got supervision on the horizon, which is obviously going to allow technicians to be much more valued in the community pharmacy. So, I think that's a real key change that we're just coming to now. So I think it's an exciting time that we're coming to. And I think the other thing that plays into that is making sure that because pharmacies are so stretched with what they're doing, with the amount of money they're getting for that, actually everybody needs to be playing their role. Every member of the team needs to be working at the top of their game. And we need to be investing in that. And I think there is sometimes a reluctance to see that return on the investment. And I think some people think it doesn't happen very quickly. And I think we need to, again, change how we're describing that and how we're talking about that, because it is huge. And I think there's probably not a lot of information and research out there that shows what that return is. I think we're starting to see more coming through. Certainly there's been a research piece into the role of the pharmacy technician, which came out last year from the including the devolved nations as well, around what does pharmacy technician advanced practice look like. And I think that's an area that there's definitely going to be a lot of movement in going forward.
Yeah, and advanced practice, that's another day. That's a debate for another day, but certainly that aspect. And one of the things I found certainly in practice was that pharmacy owners then chose maybe not to train technicians because they were going to primary care.
Yes, absolutely.
And there wasn't a pipeline there. Now that probably gap's been plugged.
Yes.
And so I could see how the role of the technician hub and spoke legislation coming in. You've mentioned already, Emma, the supervision changes. All these enablers are beginning to align to allow technicians to really come into their own.
Yeah, absolutely.
No, great. And Danielle, I'm going to come to yourself there. Just staying with the technician-pharmacist link there, because often pharmacist support, there for pharmacists, etc. But without a real good support team in the pharmacy, I could understand how that pressure can move very much to the pharmacist.
Absolutely, yeah. And I think when you were talking, Emma, then workplace culture very much comes into it as well, because you talk about retention. You know, if we're not looking at our culture within community pharmacy and thinking about how do you make that a really good place to work, and we know the pressures. I mean, we do our workforce wellbeing survey every year, and this year it included pharmacy technicians for the first time, and a lot of the issues are very similar. You know, they're all facing very similar issues in terms of, you know, the work stress, the workplace pressures, lack of kind of protected breaks, that type of thing. The issues were very similar, so it talks to kind of the workplace culture, I would say, and having to really look at that so that people do want to stay. And then we look at the training, which, again, if we're developing staff members, that helps with the wellbeing side of things as well.
Sure. And in terms of wellbeing that we mentioned there, Danielle, what's the key themes that you see coming through, particularly in the community pharmacy setting, about well-being or concerns that you see? Is there anything that you would point out to us there?
Yeah, I mean, the start figure really from our last survey was 91% of people working in community pharmacy, and I'm talking pharmacy technicians and pharmacists, are at high risk of burnout. So that's quite a shocking figure. So again, you know, when I talk about culture, I think that's something we need to address. And kind of some of the key issues that kind of drive that burnout are kind of lack of work-life balance, working long hours, not taking adequate breaks, not feeling like they're getting protected learning time to do that development. So all those things are kind of driving that kind of high levels of potential burnout. Yeah.
And these sort of things are then eventually what, if we could crack them, would mean that pharmacy become community pharmacy, and particularly what I'm interested in for Numark members, becomes the desired place to work.
Exactly.
Absolutely.
And I can see how technician role would be key to that, in my opinion, and how that supports a good culture and an effective pharmacist, clinician, technician relationship.
Yeah, I think you touch on the sort of stress side of things. I think that when you get a pharmacy that isn't developing the rest of the team, the pressure does, like you say, fall on that pharmacist. But actually, with the role of the technician now, a lot of that can be shouldered by the technicians in the pharmacy. They can be supporting the support staff training. And I think that's a move away from what has been a traditional model. And I think, again, that will help with the workplace wellbeing to share that across the team.
Oh, great. And Gemma, I'm going to come to yourself there as you listening to that debate between Danielle and Emma. You've got an example for us where I would suggest the workforce is well developed to allow you to deliver the type of services you've got here. So could I ask you, would you comment first on how you see the importance of the workforce to an effective community pharmacy, and then tell us how you, or what's been happening in Aylesbury about some of those services you've developed? So over to you.
Yeah, absolutely. Thank you. So I think as kind of Daniela and Emma have been saying, you know, we need to think about the kind of workforce differently. We need to support and develop them to make sure we can kind of cope with kind of the increasing demands. But also I think that wellbeing is really important. We know if we spend time on training and developing people, they are kind of happier and more empowered kind of in the workplace, which is more likely to keep them retained, more likely to keep them well, and supporting the delivery of kind of community pharmacy, which is essential to support kind of all people to stay well, and also to ease pressure on some of the wider NHS services. So I think it's really important. In Aylesbury, we have been developing, we have developed something called Health on the High Street. It's been running for kind of just over 18 months. And it's a shop essentially in the town centre of Aylesbury, which brings kind of health and care professionals together, be that NHS trusts, be that voluntary and community sector, or mental health services under one roof. And the focus is you don't have to book appointments. You can come in and you can fit it into how people live their lives in a similar way to community pharmacy. And it offers kind of advice, guidance, prevention, support, signposting, as well as kind of specific appointments, things like adult social care assessments, as well as sexual health advice, as well as kind of health visitors there to support with the early years throughout that whole life course. And we've kind of worked closely with community pharmacies in Aylesbury to make sure that our services complement each other and we can support and signpost, enabling people to look after themselves, know where to go, but also that there's that no run front door and they're not going to just be pushed away and told somewhere else to go to.
And Gemma, that aspect you mentioned there about social care and healthcare as that actually sits, because I always find that medicines straddle both care settings. You know, it sits in health and it sits in social care, very often for administration accepted. How do you see that being facilitated in the type of environment you're talking about between social care and healthcare, and making sure medicines don't fall down the gap between the two pillars?
Yeah, absolutely. It's really important, and the feedback that we get from all of our kind of population and service users, they don't understand the difference between the different services. So it's working together as much as possible to share that information, to share kind of what medicines patients are on, and to kind of flag early signs if things aren't going well. So if there's kind of like if people are more at risk of falls, for example, or a social worker goes in and identifies that patient's not taking their medication, or if the community pharmacy can see that those prescriptions haven't been collected. So it's kind of sharing that information as much as possible between each other to catch those kind of early warning signs, and to kind of join up so that we can support people, medicines being a core part of that.
Smashing, thanks. And we've been hearing a lot there about wellbeing, particularly there, and I'm going to come to yourself, Danielle, about wellbeing in the pharmacy, and we've talked a bit about it already. But really, where do you see the role of the owner, the employer, sitting within that well-being for the team, and what can they do to set the scene for a good place to work?
Well, they're crucial because they set kind of the tone, the culture of the whole kind of business. So if they're not bought into kind of seeing the importance of it, it's never going to work because it's really difficult. So I think from our perspective, we think about kind of stress at work. So stress at work impacts everything. It's not just a work problem. If you've got a stressful job, that's going to start kind of impacting all aspects of your life, your family life. You don't really get that downtime. You think about the potential high levels of burnout. It's very difficult to come back from that if you're not kind of relaxing when you are away from work. And 18% of people we found through our survey last year took time off work because of mental health issues, working in kind of community pharmacy and all pharmacy settings. So you'd think, there's a critical role for employers to play to kind of look at, well, what's driving that culture? Why are people kind of at the point of burnout? And like I mentioned before, I suppose long hours, high workloads, lack of colleague support was something that came out quite key in our survey, particularly senior support, and not feeling like mental health was really given a priority at work. So I think that's really interesting, because I think if we want to drive a culture where people are open and honest and can say, actually, this is what's happening, what can we do to drive some change? If that culture's not there, you're just going to kind of keep going and potentially get to the point of burnout. So I think for me, employers play that crucial role. We developed some training last year focused on support for managers and leaders, focused mainly on workplace culture. So how do you drive that? Because that, it's easy to say, but how do you do it in practice? Sure. And, we often find managers particularly, really want to do something about it, but just feel overwhelmed. They've got lots of pressures, there's financial pressures, as Emma mentioned, there's lots of things going on. So what skills do they need to do and have to kind of encourage those conversations? So I think it's, you know, if at the top there's that permission to kind of focus on well-being, it's not a nice to have, it's like, actually, we need to be training our managers around having mental health conversations. We need to be looking at ways that employees can kind of feedback the problems and we talk about them together, rather than it just being kind of this pressure cooker and all of a sudden staff leave or staff go off sick. So I suppose to me, if it doesn't come from the top, it's really difficult to change a culture from the bottom up.
Yeah. And you mentioned it, Danielle, that you've got training available. So how would the likes of my Numark members get access to that information if they're watching this podcast, for example?
Yeah, so
think, I'm interested in that. How would they go about getting access to that?
So there's information available on our website, the Pharmacy Support website. And it's actually an online course, so it's 6 modules that you can take at any time that suits you, which we felt was quite important because we know the pressures. It's not always easy to fit in the training, and if the culture's not great, you're not necessarily going to get the protected learning time to go away and do the training. So it's 6 modules, and each one focus on a different area. So there's a module, for example, about communication, how you have those difficult conversations. Simple tips, because what we were kind of fed back was, you know, if you could give us just a simple way of doing this, right, write it down, how would you go about it? And, you know, often people like a tick box or a form. So we were focused a little bit more on kind of practical things that people can do. So we have things like a sample My Wellbeing plan. So that's slightly different to like a one-to-one form. That is a conversation about, you know, what causes you stress at work? What are some of the kind of barriers for you? How can we kind of put things in place to make work easier for you? And I suppose all of those things should then lead to kind of a healthier culture, and also kind of that permission that people can talk about mental health in the workplace, because it's not always, you know, easy to do.
No, indeed. And I'll turn back to yourself there. Sorry, any build on that?
Well, I was just going to say, I think part of that, you know, when we look at apprenticeships and as a mechanism for training, apprenticeships aren't just about the technical training. Apprenticeships are around a curriculum that actually helps the person to grow.
Really good point.
And actually, that's something we've been really keen to support within the apprenticeships that we build, that the curriculum isn't just the technical part of being a pharmacy technician. It's actually about helping them to grow into that role. And you know, we do provide mental health training around their role, so that we're building their resilience, and we have pastoral support for those trainees as they're going through that, so that actually they're understanding their own way of doing that, and these are the people that are going to be the leaders for the future. And actually building that into the workforce through the initial education is really important. And I think that's, you know, that's a really important thing that we can do as an education provider, to ensure that that's built into a curriculum that doesn't just support the technical pharmacy elements, it supports those soft skills and that resilience and the other pieces around the edge. And
it's probably fair to say, my experience anyway, in the past, we've maybe not been so good at covering that off.
Absolutely, yes. I think in the past we've very much gone, oh, we need to have the regulated training, we need to be able to show that we're competent in that regulated role, but we've not necessarily thought about what wraps around that in making them a really good professional in their own right.
I think you're absolutely right. Registered healthcare professionals now.
Yes.
And how does the behaviours go along with the technical aspect of assembly that goes ahead there? This one maybe might seem as though it's coming at left field from him, but in that aspect, Scotland, England and Wales have traditionally had technicians in the community pharmacy setting. Northern Ireland, not so.
Yep.
And looking at legislation for that to be, if we look at the Northern Irish community pharmacy strategy, it indicates that they will introduce the pharmacy technician role into Northern Ireland, and we have obviously a good number of members in Northern Ireland. How would you see a company like Buttercups and Numark being able to support the introduction of a new workforce member for that team?
Yeah, so I'm already involved in some of that work going on in Northern Ireland about getting technicians registered. So I've been sitting on an advisory group around that already. And I think we're also still training technicians in Northern Ireland. So whilst it's not necessarily a registered profession at the moment, there is still training going on. We do still provide that training that's there. So I think this is obviously just getting Northern Ireland to catch up perhaps with that professional recognition piece, which, as I talked about earlier, is really important in moving the dial around how that role is seen and how it's developed. So I think, you know, there is already a lot of people that are working in those technician type roles in Northern Ireland. I think the challenge is getting this right in terms of bringing it in from regulation point of view, and that's obviously not my responsibility. But I think we can learn our lessons from how it arrived in the UK, in England, and Wales and Scotland, because there were things that happened that we might have done differently had we known some of the implications of that. So I think Northern Ireland can learn from that, and I think I'm optimistic that will roll out quite seamlessly. So I think there is obviously lots of learnings to be had around what we did, and I know there's a lot of people in Northern Ireland looking at some of the things that are going on in England, Wales and Scotland, and trying to take the best practice of that and put that straight into Northern Ireland. So I don't think that it's necessarily a new concept for Northern Ireland. I think it's just more around the recognition and how much further they can go with it. And I think that's where there's obviously a role for us to help to support your members in Northern Ireland around, you know, that advice and guidance.
That's a really good point, actually. It's not completely brand new.
No.
No, the registration is.
It
but
is.
The function is quite different.
Absolutely.
Similar,
So it's just about how you now adopt that into your working practices, your business practices, and see the benefit, the return on that investment. Because, you know, there's good documented evidence around, you know, what a return on investment can be for technicians. And we've done quite a bit of work around that ourselves, around, you know, what do employers say is the benefit of having a technician, and how quickly are they actually providing that extra level of accountability and responsibility to take new things on within the pharmacy. And we found within 6 months, you've got trainee technicians showing better judgment, better accountability. You know, it's a 2-year course, but actually even within 6 months, you're starting to see some benefits of that person being upskilled in the workplace.
No, definitely.
So that's really important. So I think that's the sort of conversation we need to continue and need to share around what are those benefits.
And certainly for me, I like to talk about the pharmacist, if we define them as the clinician, that they can very much deal with the safety of supply. In other words, more around, are you getting the right medication at the right time, and is it doing the right thing for you? For me, that's safety, and let my T&T, technology and technicians, deal with the accuracy of supply. Making sure that the accuracy flows through, but actually we've got these two very important streams coming together about accuracy and safety. And for me, community pharmacy is absolutely the place to go there. You know, you mentioned benefits. I'm going to come back to yourself now, Gemma. When we mentioned, now it's benefits really for workforce and pharmacy, but staying with the theme of benefits, how does the operation that you've now got, or you see in Aylesbury, what are the benefits that you see to patient care and then to workforce care? Is there something you'd like to build upon from those 2 points?
Yeah, of course, thank you. So the benefits to patients are that they can access services in an easily accessible location and in a time that kind of suits them. So they can go in a way that fits into their lives, not in the traditional kind of model that outpatient services within the NHS are provided. And also we take a lot more kind of preventative and proactive models, so people can take that initiative and be empowered to do things themselves. And we've seen kind of, you know, in 18 months, 26,000 people have come in, or people have come in 26,000 times. So some individuals really value that support, being able to get that advice and coming back to get that advice, which it might be difficult to go and get from a GP if you perhaps didn't quite remember something right, or didn't jot the right service down. You can come and get that. So it enables it to be a lot more personalised and a lot more flexible. And equally for kind of the workforce, it enables them to kind of provide care in a different way. So it enables that kind of proactive and preventative support, which can have kind of a great satisfaction to individuals. Kind of talking align what you've been talking about as well. It's upskilling people to do things differently. we perhaps haven't traditionally trained people to think about that preventative and proactive model, and it can do that, taking away from that reactive. So it can provide them a greater variety in what they do, and greater kind of satisfaction through the feedback in which they're supporting patients.
Yeah. And generally, what's the feedback like from patients at the minute? Gemma, what would you say? Are you getting any feedback from them directly about this way of working?
Yeah, we get really, really positive feedback. So it's overwhelmingly positive. They like being able to have that access. Obviously, we know it's kind of well reported that it's quite difficult to access kind of general practice services, and waiting times are longer than they would ideally be in some of our other services. So they really appreciate that support. They want to look after themselves, but it's increasingly difficult to kind of pull out what information is correct in kind of those healthy behaviours and what information is wrong, with kind of social media and lots of different kind of competing priorities. So being able to come to one trusted source to get that information. It's also really helped with things like social isolation. So people that maybe feel lonely or socially isolated have used it as a place to kind of come out and start to overcome some of that, and be signposted to a lot of kind of community services or Tai Chi or walking groups. So it's really benefited that. And a lot of people as well were perhaps unaware that there was kind of issues with their health or behaviour. So they can come in, they can do a mini health MOT, and it's identified people with high blood pressure, people with kind of that were overweight that didn't realise they were, and it's enabled them to do something about that, and respond positively to their health. So really, really positive feedback from patients all around.
Yeah. And Gemma, you're still, if I'm right, catching up on what you said earlier, is that this is still able to be delivered on a walk-in basis. You know, it's easy access, readily accessed, would we say, one of the key pillars or cornerstones of community pharmacy, that this is a walk-in facility?
Yeah, absolutely. There are a couple of appointments that are booked, but people can walk in to book those appointments. They don't have to go online or ring. But a lot of the services are just walk in, so they can come in when they want to and access it. So really similar to community pharmacy, just giving some of that wider support and that time to do that. And that's been one of the most beneficial, one of the things patients have benefited from the most.
Yeah. Right, so we'll stay with the theme, Danielle, of just walking in, because that's one of the things that people would say, actually, that can lead to distress. You're never quite sure what's going to come through the door. Yeah. I have to say, when I was in practice, I actually used to quite like that, because I felt that was where you put your degree to the test. But some people can find that disconcerting in terms of how do you manage all this workload. Yeah. So any comment you would see there to colleagues about that?
Yeah, I mean, I suppose the way we've seen it as well is, and it's really interesting what Gemma says, because when everything's more joined up and the patient's more satisfied, that really helps the pharmacists be more satisfied in what they're delivering, because what we've found is there's a direct link. You know, I'm not going to go into all the issues that maybe pharmacists have faced through kind of the NHS pressures and different things that are happening, but I think COVID kind of started people to realise that pharmacists are on the front line. And particularly in the pandemic, they were probably one of the only healthcare professionals people could see. Absolutely. And we saw the negative impact of that, of kind of they got the brunt of frustration. And I think what we've seen in more recent years with the medicine shortages and things like that is the direct link between that and how pharmacists feel at work. So we heard that pharmacists felt their mental health suffered when they couldn't kind of deliver the service of care that they wanted to. And I suppose things like Gemma talked about, that, you know, if you think about your own work satisfaction, is so much better than feeling like, you know, someone's walked through the door and you can't help them, or they've come and you're saying, actually, you need to go somewhere else, and that's quite difficult. So I suppose, you know, that takes its toll. So I think that's how we see it from a pharmacist's perspective. They just, you know, a lot of pharmacists went in to help in the best way they can. Absolutely. And when they can't, that makes it difficult, and that does have an impact on their personal mental health and well-being. Yeah.
And any tips that have come up around that, or anything you would say to the team to consider in that situation?
Yeah, I mean, I suppose lots of the skills we talk about in terms of workplace culture obviously then help with dealing with patients. And I know, as we talked about previously, a lot of that is now in the training, you know, at universities, pharmacists are doing a lot more around having those conversations with patients, and how you deal with patients who are distressed or, you know, really frustrated with what's going on. And I suppose it is about that culture and making sure that they feel prepared to have those conversations, because it can be really difficult. And what you've got in place, if you have had a really difficult patient or someone who's been, you know, verbally abusive, which we know does happen a lot in community pharmacy, you know, the impact of that on you personally, you know, you need the culture within pharmacy to be able to say to that person, you can go and take a break, you need to go away. You can't just deal with the next patient even though there's a queue out the door. So I suppose, again, I keep harping back to it, but the culture again to allow, you know, people to say that was really difficult and are you okay? And I think, you know, keeping that conversation and then providing people with the tools through different training is really important.
And the resources that you've got for people to then access there.
Yeah.
And that takes us back, I think, Emma, to the point around an apprenticeship being much wider than just the technical aspect of it, how you handle some of these things.
Yeah, absolutely. And I think what's really interesting and probably really heartening to hear from Gemma around the model of what she's been introducing in Buckinghamshire there is, you know, what I remember community pharmacy being when I first started in practice, and that was being at the heart of the community 100%. And being able to support that community, because that was what gave me job satisfaction. That was what was really made me tick, what made me want to go to that pharmacy to work. And actually, you know, I see an opportunity that we may be coming back round to that, which I think is really exciting. Because I think you know, what we've been hearing from the government plans around that movement from secondary care into community, I think it provides a really big opportunity for pharmacy. And I think, you know, the model that Gemma's has set up there, you know, that's probably a very big kind of pharmacy system there, but actually in a small village or whatever of a small community with a pharmacy, you can do elements of that quite comfortably. And I think, like you say, that brings together both the job satisfaction piece, because you're able to provide those services and care for your community, which is what most pharmacists go into pharmacy to do. But also the patients get the satisfaction, because I think some of the things we overlook is the complexity of our healthcare system. And I think that is one of the biggest barriers we have. And I think listening to what you're doing, Gemma, is just lovely, because I think that just reduces that complexity for the patients, because they just don't know where to go, who to trust, what to do. So having that trusted place, which we know pharmacies are very well trusted, is a really good opportunity to move the dial forward on that wellbeing and that preventative side of things. So I'm really excited about what's to come with that. We've actually been piloting something with the community pharmacy in the south around that, actually, which is, you know, along that almost a social prescriber type role, whereby actually you're bringing the community you're serving them, they don't know where they need to go, but they can come in and get that advice to know, actually, can we service it within the pharmacy or or actually where do I need to go from that, and supporting that in their communities. So I think that's going to be quite an interesting area for development as we move forward.
Thanks, Emma. And Gemma, I saw you nodding along with Emma there when she was making her comments. And one of the things she said there was social prescribing. But I'm actually just going to shorten it a wee bit to prescribing. And I'm keen to hear if the pharmacy in Aylesbury has a pharmacist prescriber in it. It may or may not, or is that something the pharmacy is looking at, or the service you've got, has got that incorporated?
So the service we've got doesn't have a prescriber incorporated in it, but they can access a prescriber if needed. So it's not there to have it. But sorry, just to go back to Emma's point as well, I think in Buckinghamshire we're also looking at developing kind of neighbourhood health in line with some of the government plans. And we in Buckinghamshire see community pharmacy as essential to that, both in terms of the provision that you can provide, but also understanding the needs and the insights of the community. As I think it was Danielle said, pharmacists are on the front line. They know their communities, they know their populations, and I think it's really important that they are given the opportunity to share what the needs are, and they see a side of the health service that other professionals don't. So we need to hear from them to understand how we can improve it for them, but also for patients. So we're really keen for community pharmacies to get involved in the development of neighbourhood health.
And just, I suppose, I'm going to stay on the prescribing bit, Gemma, just for yourself around, is that something you would consider seeing introduced into Aylesbury in terms of a pharmacist prescriber? I know they've got access to one you'd mentioned, Would it be a thought to have one in the premises at the same time?
So I think we probably, I mean, it would be beneficial to the patients. We'd have to work with our local pharmacists because obviously there are pharmacies in the town centre to support that. But yeah, it would be something that patients would definitely see as a benefit. And
that whole bit about the digitisation that's in the NHS 10-year plan, about how that could be connected as an aspect. Gemma, thanks for that. Danielle, I think I've come to you as well about prescribing in terms of well-being and how things go. I could understand how a pharmacist, relatively new in their career, will be coming out to enter the register next year as a prescriber, and how that could impact on how they might be feeling about working in the community aspect. How has pharmacy support thought about that, or what's their thinking at the minute?
Yeah, I mean, it's very much on our radar because it's going to be very different, and it's going to, if you think just about pharmacy in general and how that's going to change things, we're concerned about how that affects workplace relationships because, you've got people coming out who's just qualified, who's going to be able to do all these great things, and you might have, they might go and work in a pharmacy with a pharmacist who's not a prescriber, who's worked there for a long time, and how that works, and that's difficult, I suppose, for both individuals in that circumstance, and I suppose for newly qualified pharmacists, it's about, we already know that's incredibly difficult for them. A lot of them suffer with, they're expected to kind of take on a lot of responsibility very quickly. Yeah. So if they're already concerned about that, you think about kind of this new cohort who's going to have even more responsibility on their shoulders. So I think for us, it's about just breaking it down about the support that is in place and about, you're not just expected to do absolutely everything. You've got to feel comfortable with your level of competence and what you're doing in practice. So, there are safeguards in place, but I suppose, if you're just starting a new job, you naturally feel that pressure, don't you, to kind of perform. So I suppose it's something that we're very much keeping a watching brief on because it's going to be very new. We don't know what maybe new support those people might need, but I think for us it's just about making our support available so we can start to see trends and then potentially work with other organisations within the profession to say we're noticing that actually there's a real problem here and we didn't expect it, but what can we do? Yeah.
Making sure people are not alone.
Exactly, absolutely.
That there's a connection in there and what could be. And that takes us back to what the technician role can also be in terms of if we've got a prescribing this safety aspect, just how important the accuracy bit really becomes.
Yes.
And that seamless supply process.
Yes, you talked earlier around the accuracy, but also being automation coming into that, and I think that's going to have a big role to play with where we go going forward, because I think one of the challenges we have in education is not just around what we educate them but when. Because I think there is particularly with education standards, when you get a big review of an education standard, it's in place for probably 8 to 10 years. And actually the sector can change quite dramatically in that time frame. And therefore, actually, when you're setting those standards, how far ahead do you look for them versus what you've got in the here and now? And I think that was, that's one of the things I think we learned from the first setting of the IET for the technicians in 2017, because I think at the time we were setting it too far ahead for community pharmacy. Because the roles weren't there for it, and therefore we saw that workforce leave and go to places where they could do those roles. But obviously we've got coming up now, we're likely to see the new review of the education and training standards for technicians. So actually, what does that new set of standards look like? Can we future-proof them with what we think might be coming in the next 5 to 10 years? So certainly the wellbeing agenda needs to be very heavily focused in that. But I think the technology and the automation agenda needs to be in that. Because I think we're going to see, traditionally a lot of technicians see, accuracy checking as their next career step. But actually, most of the automation is going to take care of that accuracy checking. They're not going to need to do that. But they do need to understand how the systems do that safely. And what the processes are things. So we're going to need to understand a slightly different angle of accuracy checking and how that works in the processes and the systems. So the role's going to need to adapt to do that, and we're going to need to build that into the training that we provide. So we're already looking at what we're calling emerging skills, which is around, AI coming in, automation, and even, sustainability as well will be some of those things that are going to be coming into those future curricula. So it's a very challenging thing to get it right at the right time, because when you're training for that snapshot in time, that is a difficult point to get. But I think what is important to do is that for the future, we have those generic skills that are transferable and that can be moved, because people are going to find that the sector moves quite quickly. We're going to need to build those skills so that A, they're resilient to be able to cope with the change, and B, that those skills are transferable as the roles and the sector evolves.
Well, definitely, you mentioned as it changes, and Gemma, I'm going to come back to yourself in terms of that change in service and change in how different things are being delivered, principally on the high street, or as Emma said, at the heart of the community where people actually are. What would you see, or what if you didn't ask of our Numark members in terms of change in service adoption, what would you ask them to do?
Well, that's a good question. I think, as I mentioned earlier, it would be to engage with kind of healthcare services to tell us kind of how it feels for you and how it feels for your patients, and then the kind of greater focus on kind of prevention and making every contact count. So I know pharmacists do that, but really kind of embedding that. And I know it can be difficult when it's busy, but actually we know in the long term that's going to kind of reduce demand and support our patients and our populations to be better. So really embedding prevention into kind of practice for everybody that works in the pharmacies, making every contact count and engaging with us to tell us what we can do better.
Yeah, no, great, thanks. And I'm going to stay with the same theme there. As you go through, Danielle, a change tends to be an area of concern, or it can cause anxiety when you go through change.
Yeah.
And we've already heard from Emma, and a request for Gemma to say, actually, well, we get engaged, in that change programme. How would you see pharmacists supporting dealing with the change? Because I agree, I think change is imminent.
Yeah.
It won't be revolution, but it will be evolution. We will be changing. So how do you see pharmacist support being able to support that change and being able to deal with the resilience as you go through it?
Yeah, because you're right, change does impact like mental health and wellbeing. So there's something called the change curve. So we all go through it. How quickly we get through that and how we cycle through that and how we deal with that all does definitely depend on our resilience and where we're feeling. And it's easier to deal with change if you are in a good place and you are resilient. So I suppose from a pharmacist support perspective, it's about making sure that everyone's in a good place to start with. And we're very focused on the preventative side of things as well. We do offer support services so people who do find themselves in hard times have somewhere to go. But equally, we don't want people to face those hard times. We don't want people to get to the point of burnout and need mental health support, counselling. So for us, it's about kind of really being proactive, so getting individuals to think about their own well-being, what they can do. We've got lots of resources and workshops, things online that just make you really think about what you can be doing, because I think we can be quite blind in it. Sometimes we just carry on and keep doing maybe unhealthy things for our well-being, and then you get to a point where you're dealing with a big change or you're dealing with something difficult and you can't deal with that particularly well because your resilience is much lower than you thought. So I think I would definitely encourage people to just think about their own well-being and think about what they can be doing just to be as resilient as they can be. And then when change comes, it does make it a lot easier.
And sometimes I'm guilty of this, hanging on to a job that you've done well for a long time. Can be difficult to go, well, actually, I'll let another colleague undertake that particular role and then let it go. And I think there's a role for all of us actually to be talking about, it's actually the appropriate person. You mentioned earlier, Emma, about working to your skill set, your qualification. And as we develop that in other members of the team, actually need to let some of the old stuff go and adapt and adopt the new.
Of course.
So as that begin to maybe start to draw us to a close, as we're going to give you an opportunity just to have a thought about what message, one takeaway message for the Numark members that will be watching this. What would be your one message that you'd like to leave them with today from Emma from a Buttercup's education perspective, Danielle from a support And Gemma, will come to you last if that's okay, for what they would do, a takeaway message from you about services. So Emma, I'll start with yourself. What would be one of the takeaway bits?
I think the key takeaway message is that upskilling and training your staff is not just it's not a disruptor, it's an enabler. I think it's about everybody needs to be supported and move to the best role that they can fulfill to get everybody able to deliver what we're going to need to be able to deliver under the funds that we've got to deliver that.
Yep.
I kind of like the sort of the old proverb mantra: if you want to go fast, go alone. If you want to go far, go together. Because I think that's really about building up your team capability to actually achieve more. So I think from my key takeaway is really that this isn't just about individuals being developed, it's about how you work as a business and developing everybody along that way.
Yep. Smashing, thank you. Danielle?
And I think building on that point, to do that, we need to look at workplace culture. So I think my key takeaway is that that's not a nice to have. That's not something we do on the side. That's something that should be at the core of everybody's businesses. It should be, what can we do to create a positive, safe environment? Because I think if we do that, everyone thrives both professionally and personally, and the whole team work together because we've created that great environment.
Yeah, great. And Gemma, your point for the members?
I think the NHS as a whole is moving towards kind of prevention and moving things in the community, and a lot of the good things that are being identified are what community pharmacists already do. So kind of please be at the forefront of that and get involved so we can improve services for all.
No, thank you. And certainly for me, listening to the debate and the chat we've had, believe it or not, for about the last 50 minutes, is the aspect that I've taken away, certainly the apprenticeship bit, Emma, and this bit about it's not just about the technician.
Yeah.
It's how that's a much wider piece. I think that's a really good message to get out to the workforce and community pharmacy network, that actually this is a real enabler for you.
Yep.
I thought that was there. Danielle, taking away the aspect of the training and what's available to help with the culture, and because often sometimes you think, well, how do you go about tackling some of this? And you mentioned about 6 small blocks that can be chunked up for the pharmacy team. I think that's another thing that I'll certainly reflect on and be able to, what's available. And Gemma, you've mentioned certainly the heart of the community, thinking about prevention, getting ahead, but that real integration between social care, healthcare, and how medicines sit at the centre of that. So just certainly another message for the community pharmacy network for me to take away and make sure that this comes through on this particular podcast. So it really just remains for me to say thank you certainly to Gemma and for joining us over the airwaves today and contributing with telling us about Aylesbury and the services that are available to patients there. Danielle, thank you very much also for what's available from pharmacy support and how this is going to be important as we go ahead and supporting wellness within the community pharmacy setting. And Emma, these new roles, not new roles, but the expanding role, and how that's going to develop in the education standards and the facilities that are behind it to make sure it's available for community pharmacy. So we look forward to seeing the outcome of today's chat, getting it out to the membership and getting some feedback and what we've been able to say. And can I express my sincere thanks to you 3 ladies for participating with us today. Thank you very much.